Hi viewers, I'm Dr. Uchira, your dental surgeon at Eledent Hospitals. We are located in Kondapur and KPHP. Today I'm going to speak about different types of caps or crowns that are present. First one comes metal, wherein metal crowns are nothing but purely made only of metal, and these are not very user friendly, or people don't prefer it much these days, but nevertheless in situations where your financial conditions is not very strong and you cannot really afford something which is a little more expensive, people end up going with metal. Whereas you have other option which is called porcelain fused metal. This is nothing but where there is metal present on the inside, and on the top layer it is ceramic. So there is metal on the inside and ceramic on the top. These are called porcelain fused metal crowns. And in this there are two types, where we say there is ceramic, basically tooth color on the outside and metal on the inside. We have two types. One, we have DMLS and we have PFM crowns. So what happens in DMLS is, this is laser centering technique done, where it is done via computer, and it is mostly computerized way or form of making these crowns. What happens is, where you prefer a normal crown or a DMLS crown, in your normal PFM crown, what tends to happen is, eventually the life of that crown is not very high. It tends to break off or things like that, or chip off. Whereas DMLS crown, what happens is, it is made in a computer, so the chances or the tendency of it to break, or for it to have a crack or wearing off of the material doesn't happen much. So personally, we prefer going for a DMLS crown over a PFM crown. People tend to ask, why is your clinic charging us higher prices compared to other clinics? That is only because you have to know the kind of crowns that we are delivering to you. The whole reason of why we are trying to make these videos are so that you have enough awareness of what are the different materials or the various different options present in the market. And we personally prefer going with anything which is a DMLS crown, since it is much more quality proof, like much superior of quality than your normal PFM crowns. Secondly, after I finish the PFM crowns, next what I'm going to talk to you about is Zirconia crowns. N number of people nowadays know what Zirconia is and what crowns they are, because a lot of patients walk in coming to me asking, madam, we want to go for a Zirconia crown only. So when I'm telling you Zirconia crown, there are again different types. So basically there are different brands. Today my clinic, or the clinic where I'm sitting, charges a higher price compared to any other clinic outside, is because our crowns are European made and not China made. What happens is, there is a lot of quality difference or the texture difference that you will automatically tend to know once you see the two different types of crowns. If I show you only one type of crown, you will never be able to differentiate. But when you come over to our clinic, I'll be able to show you how one crown is different from another. That's how it works with Zirconia crowns. In Zirconia crowns, we have n number of sub brands, so every brand has its own name or its own thing. But at the end of the day, these Zirconia, the European made Zirconia ones, are the ones which we make. So we are the ones who use it. There are something called as CIRAC. So with us, we have a technology where we call this a chair side CIRAC. We have a machine in our clinic which gives your crowns in an hour. So we make your Zirconia crowns ready in an hour for it to be placed in your mouth, and this can be done according to your comfort. So basically you can choose your size, you can choose the color and things like that. Usually for posterior teeth, we prefer these crowns, Zirconia crowns, based on how your dentist decides to go about it. But whereas there is another type of crown which are called all ceramic. These are called lithium disilicate crowns. These are not very strong compared to your Zirconia crowns, but what happens here is, in your anterior teeth or in your front teeth, you tend to use these because it is much more easier to be placed, or it looks much more very pretty, but not very strong, because of which we cannot usually prefer it on your posterior teeth. A lot of the Bollywood actor or actresses tend to use these lithium disilicate crowns, which are nothing but ceramic crowns. There are some where we have Zirconia crowns coping with ceramic. So these are all various techniques and various ways of how we try to help you, giving different types of caps based on your comfort, your economical status. And each type of crown is made in our clinic, but my personal selection for crowns is always a DMLS crown or a Zirconia crown. Whereas what happens is sometimes when the crowns are made, now for example, if you get your crown, if our crowns are made in a lab outside, what happens is, what we have noticed is they tend to have certain type of leakage. So when I say leakage, it means that there is some gap present, because of which you tend to, while you eat, your food gets stuck over there. So basically it's called food getting stuck here and there. A lot of patients keep complaining that the food is getting stuck here, there's deposition of food, and that it constantly is a very big trouble to keep taking it off, on and off. So in situations like that, while we design our crowns, we make sure that they sit properly in the area that it's supposed to be. So you tend to have no much of food lodgement or no type of any leakage which is present. That is how we work here. Anyways, I hope you have liked our video. Please come down to our clinic sometime to know more about our different types of crowns. Thank you. Goodbye.